Welcome to Living a Full Life podcast. Join us as we explore health topics that encourage raising healthy children, living a healthy life, and living the best life possible. Now, here's your host.
Hi, welcome to another episode of Living a Full Life. I'm Dr. Enrico Dolcecore, and this week, the importance of regular blood work. This is an oversight for many of us. We may procrastinate on blood work. We may skip years where we do blood work. But one of the most obvious statistical prevention things in the medical field from all my friends that are medical doctors, I say, what's the one most important thing in medicine? And they all unanimously say the same thing. Your annual preventative maintenance or wellness check, as they call it in medicine, is probably the most important thing you can do for many different reasons. And that's what this whole podcast is about. Your blood work is an inside check of how everything is working. It gives us insights to almost all the systems. It may not give us answers. Let's be honest. But it gives us insights. It shows up red flags. It shows up concerns. It can show up projected diseases that might be happening. Pretty obvious of what blood work can do. But we need to understand what blood work really is and why we need to do this. And if you're young, does my 9-year-old have to go in for blood work all the time? Does my teenager have to? I'm 55. Do I have to go in for it? Whatever it may be, whatever questions are going through your head, is what is blood work? It all depends. Your child may have to go in for regular blood work for something. Maybe it's type 1 diabetes. It may be whatever it may be. But the only way to figure out these things is by checking the blood. So today's podcast is to rejuvenate your understanding of what wellness care really is. Wellness care is taking good care of yourself. That's what it really is. So we're going to go through what blood work is, what you should look for, and why it's your responsibility to keep track of this. No one will care about your results, not even your doctor. Your doctor has and swore to an oath to do no harm. So when they send you out for blood work, it's their job to review the blood work. And if there is any red flags, they have to diagnose and prognose what to do next. That's their job. Once they do that, whether you swallow the pills or do exercise or whatever, that's your job. If you don't do it, maybe they'll show up at your funeral. Probably not. They won't even show up to your funeral. So really, and I'm just being honest. So we're going to go through this podcast to rejuvenate your understanding of wellness and invigorate yourself to take full control and full responsibility for your body, for your health, for your wellness, for your future. That's what it's all about. This is unanimously across all healthcare, is that we need blood work. And it's probably the smartest thing you can do on an annual basis to just keep track of things. Major systems, your heart, your liver, your pancreas, your digestion. It can show a lot. Your hormone system, your brain. It can show a lot. So common tests when you're sent out for a common blood work or your wellness check, it's usually your CBC, your blood panel, your lipid panel, which is the triglycerides and fats in the blood. And there's good fats and bad fats. Your blood glucose. And that's pretty much the standard. They may throw in thyroid in there. They may throw in a hormone check, a vitamin D check. It's up to your doctor to what they do. But typically it's a CBC checking your red and white blood cell profile, which shows us overall health. I mean, red blood cells tell us whether you're living or dying right off the bat. So healthy red blood cells, generally a good start. The white cells, lymphocytes, monocytes, all those sites, those white cells can tell us what's happening if you're fighting an infection somewhere in your body or disease. So that's important too. Your lipid panel strictly tells us how well your liver system is actually working and enzymes and all that come with it, and how the liver is actually processing. Your liver detoxes the entire body. It's the detoxification system of the body and the blood. All your blood goes through there. It's a very rich organ, and it does a lot of stuff for that. Blood glucose, the efficiency of your pancreas and its response to sugars in the blood, which is really important. And then, like we talked about, some extra stuff. So that's what a common blood work is. Just a quick insight into what's going on. We know for most of us that are overall healthy, and we do the regular blood work comes back within normal ranges, doesn't tell us much. We're looking for deeper answers to be more well or stay well, or maybe fight off something that we're feeling. Maybe, we're trying to figure out why we're fatigued or why our digestion's not good. We try to dig deeper, and we're like, I just don't want a regular blood panel. But unfortunately, in the medical community, this is what they're going to send you for right away. Because if there is an increase in white blood cells, then we might be fighting an infection, which may be related to what's going on with your gut. It may be why you have indigestion. And then when we dive into that and we find out through x-ray or scanning, or maybe there's inflammation that we can see in the gut, now we can diagnose something. Maybe it's from an ulcer, maybe it's ulcerative colitis, or maybe it's from overgrowth of bacteria, or maybe it's diverticulitis, or whatever it is. And then we can then see how we can figure it out. But it all starts with blood work. Even in the emergency room, right when you get admitted into an emergency room, they check your vitals. If you're stable, boom, they're pulling blood from your arm. That's the very next thing they're doing, pulling blood from your arm and then sticking you with an IV and saline until they figure out what's going on. They run that panel as fast as they possibly can, and then they check. And if anything shows up, high white blood cells or whatever it is, then they're taking another vial from you and now going deeper, looking into what's going on. Is it sepsis? Is it an infection? Where's the infection? Now they're checking your body. And that's how they help people, right? Always goes to blood. So blood work can be extensive, and it all depends on what's going on. But the main premise of blood work is that it helps in disease prevention. It really does help in disease prevention. I love the chiropractic philosophy in vitalism about how dis-ease, hyphenated, D-I-S hyphen ease, E-A-S-E, ease. The body works at ease. That's a balanced body. That is a body that's within homeostasis. It's balanced between all systems, and it's just functioning like a well-tuned machine. That's at ease. You don't have to think about it. You don't have to do anything. You just eat well, you sleep well, you move well, and the body's at ease. It's functioning. You have very little symptoms. You have very little pain. You function well. When you need to go for a run, you can run. When you need to fall asleep, you can sleep. When you need to get some work done, you can get some work done. When you need to play with the kids, you can play with the kids. When you need to drive your car, you drive your car. That's the body at ease. It can relax. It can work. It can be spontaneous. Dis-ease is when the body stops following the ease pattern. And I love this. And I learned this in chiropractic school. Like, what a great way to look at this. And it's pretty much confirmed why I never went through with medical school. That's what I love about it. We work in this area of dis-ease, of hyphenated, to help people never reach where the hyphen drops and they're in a disease. That's our goal. And blood work plays a major role. Unfortunately for chiropractors, we're always fighting with insurance to be like, hey, can we just take a look at the patient's blood work? And like, no, that's for a medical doctor or a nurse practitioner, no one else. And we're like, okay, well, let's figure out cash ways of doing this. And now major labs are all accepting DCs, doctors of chiropractic, to go for blood work because they're like, yeah, but they'll have to pay cash. But it's almost cheaper than the copay sometimes. For $100, we can see everything we need to see. And the importance of biomarkers in identifying risk for heart disease, cancer, autoimmune disease. I don't want to turn this into a pathology podcast, but that's where we're going with this, right? Seeing those things. And those things are for a medical doctor. Absolutely. Medical. This is a medical condition. Medical doctors study pathology and what makes a body die. Chiropractors study vitalism and what makes a body live. So very different things. So if you got heart disease, you're going to a medical doctor. You got autoimmune disease, we're going to refer you out. You got cancer, we're going to refer you to an oncologist. I mean, that's who's going to manage you the best, because you're no longer in a healthy state. You're in a disease state. And this is how good healthcare works. Good practitioners will play in this network. So it's really important for you. Monitoring chronic conditions. Let's say we do have some chronic condition, a skin condition, or arthritic condition, autoimmune condition, whatever it may be. We need to monitor these conditions over time. So annual blood work now becomes preventative on progression of things that can happen. Not only managing them, but our goal as Vitalistic is to maybe reverse this. We always look at that. When people are coming with a diagnosis, I'm like, that's not who you are. Your name is Sally. You're not multiple sclerosis. You may have it. Let's see what we can do. And of course, we have to stay within the parameters of matter and living tissue and what we can possibly do for them. But as a Vitalistic doctor, we're very optimistic in what we can do. So that's great as well. So the role, monitoring chronic conditions, like let's use the most common things: hypertension, blood pressure is high. We got to make sure that the cortisol and the cholesterol are within normal limits and not going to possibly go towards myocardial infarction, a heart attack or a stroke. Diabetes, we got to check the sugars. And thyroid, we can check the thyroid. Thyroid disorders can lead to can be a reason for many things, from autoimmune disorders to fatigue, to drainage, to thyroiditis, to goiter, a tumor that's there. There's many different reasons why these glands can not function properly. And we can adjust treatment plans based on blood work. Things should be treated. So this, here's a prescription, you got to take it for the rest of your life. Even your medical doctors, if they may give you something for the rest of your life, they're still going to monitor it. They should. If they give you a statin for cholesterol, or they give you a blood pressure medication for blood pressure, they're going to monitor this stuff on your annual wellness check, right? So that's it. But in the pathology sector, you've already been labeled with high blood pressure. There's nothing they're going to do to make you better. They're just going to make sure that the blood pressure medication is keeping you within a normal range to reduce the risk of heart attack and stroke. And I won't digress on the evidence behind that. So case study and evidence, make sure the evidence-based research is impacted on early detection through blood work and disease outcomes. So everything's based off of literature when we do this, and then we can start to open the scope and think about outside the box treatments. Nutritional statistics, this is what I love when we go through blood work, is looking at things like nutrients, essential nutrients, iron, vitamin D, B12. We can go into vitamin panels. We can look at heavy metals. We can look at things that may be impacting energy, mood, and overall well-being through nutritional panels. We can dive a little bit deeper. Hormonal balance, the importance of monitoring hormones, especially for aging populations, and how imbalance can affect health. All these testosterone clinics that are popping up on every corner. Everyone's being injected with hormones. We're screwing with people's hormones and barely checking and just using numbers and saying, no, your numbers are too low. You have to be here. Says who? The evidence does not show that. The evidence does not show that a 45-year-old man needs to have an 800 free testosterone level in their blood. That's not true, especially if they've been functioning at 400 most of their life. Why now increase that just to affect energy or mood? We were seeing a lot of side effects from this. So we got to look at this stuff more consciously when we're helping people. Specific blood tests to check for thyroid function, sex hormones, and adrenal health. That's why I talked about testosterone, just for an example. And assessing organ function, liver, kidneys, heart, all this stuff is tested through your annual. And let's not digress. Urine analysis can show us a lot as well when we start thinking about kidney and liver, right? So there's that too. But we're talking about blood work today. Understanding markers like the enzymes, the creatinine, the cholesterol levels, these things are all markers that should stay within a normal balance to tell us how everything is functioning. If we have too high potassium or too low potassium, now we're getting into intracellular function. So there's many different ways that your doctor, that's what their training is for. Most doctors are trained in this, and in a glance, that's what they're very good at, is seeing this right away and catching red flags right away. That's what good doctors do, is they're smart, and they've seen this thousands of times, and they know what to look for. The ones that take a little bit extra time are better because they'll maybe send you for a follow-up test or dive a little bit deeper. And that's great. And we're seeing this more in the functional medicine world of MDs, nurse practitioners, chiropractors that are going into that functional medicine route because, one, they can spend more time and see the patient more often, and two, dive deeper. So those are great. So I don't want to push you one way or another. Even if you have your primary care provider, annual blood work. The PSA of why this podcast came to now is I routinely, after 16 years, continue to hear people be like, I don't know when the last time I did my blood work. And they're in their 50s or they're in their 40s. They're in a dangerous group of like, why now are you skipping blood work? Why were you good in your 30s and not in your 50s? This is nuts. You should be better now. You should be assessing annually, maybe even twice a year, your blood work at this point, because as we age, the risk of not just disease, but our vitalism over time can diminish. So we got to keep an eye on this. We don't want it to. The whole goal of our life is to keep peak vitalism for as long as we can. If you do that, disease stands no chance. You may have a labeled pathology or a disease in your life at some point, whatever it is, psoriasis, acne, autoimmune, whatever it may be. But your vitalism can still be at peak performance. You'd be like, how? How can I have a pathology and vitalism? Well, pathology and vitalism are not the same thing. Vitalism is how peaked and how optimally your nervous system can function to control your entire body. Diseases can come and go. High blood pressure. How many people have had high blood pressure and then it goes away because they changed some major things in their life, diet and exercise? And by the way, the answer to every question for the rest of this podcast is going to be diet or exercise. So organ function, how often should you get checked? We came through a couple examples here. Annual is for sure. Now, your pediatrics, my kids, I have a almost 10-year-old, an 8-year-old, a 5-year-old. Do they need annual blood work? Typically in the pediatric guidelines is no, unless we're dealing with something, unless symptoms start to come up, unnecessary weight loss. If my 8-year-old starts losing weight unexplainably, we want to look at that. It could be a blood sugar issue. Then we go get some blood work, check it out, and see what's happening there. Skin rashes, things that may pop up, you want to check. So it's more symptom-based for children. We're not going to pull vials of blood out of a 5-year-old. They only have so many vials they can give, right? Compared to a full 200-pound male who can give more blood, right? So that is different. So we have to check that. Age, gender, health status, all those things matter. Annual versus biannual depends what's appropriate for each age group. Over the age of 50, I start to push people towards twice a year. You want to catch things early. You may do blood work in January, things look within normal range. And by July, you might find something that is off. Maybe creatinine goes up. Maybe your C-reactive protein goes up a little bit. And you're like, whoa, time out. It's better to catch inflammatory markers like that can increase your risk of a heart attack early than later. Guess when most men over the age of 45 get blood work? In the ER because of something tragic, something bad. They pass out, they have a stroke, they have a heart attack. That's when they're getting their blood work. And their creatinine or their CRP reactive protein is through the roof. They're like, they come back in the room, you had a heart attack, sir. Glad you're still with us, right? Otherwise, they'll never know if they're dead, right? So that's the typical guy. And I can pick on guys because I'm a guy. But that's when they get it. Women are a little bit better than guys with that. But it's just so obvious to be doing that. The importance of more frequent blood tests is that it can show what's going on, but it also can keep an eye on family history. Now, you know me, if you've listened to my podcast before, I don't believe we're doomed because of our genetics. Epigenetics has shown that we can turn on and off switches all the time based on our lifestyle. So I'm not that type of person. However, our history kind of warns us. It's a warning sign. It's kind of like this architectural script on the house being like, here's your house. It's beautiful. It's a mansion. It's made of stone. It's going to be great for hundreds of years. Don't worry. You've got a beautiful body. However, you're on unsettled land that has too much sand in one side of the house, could lead to a foundational crack, right? That would be a good architect telling me what's going on with the property that I'm buying and building. It's like our home too. It's this architectural plan that you're given. It's like, hey, this is called your DNA. Here you go. Put this in your pocket. Not much you can change there. So the family history and risk factors are something you want to keep an eye on. My father was diagnosed at 67 with colorectal cancer. Thanks, Dad. Now I got to do colonoscopies at the age of 40 instead of what was 50. It's now 45 on the standard. Now it's 45 for colonoscopy. But now I got to start them because, Dad, thanks, man. And for the male pattern baldness. Appreciate both of those things. But that's okay. Those are things that are passed down. And because of those, I can deal with them and stay on top of them instead of being naive and ignorant because I got kids. Don't want to put that on them, right? Personalized recommendations based on specific risk factors can happen from the blood work that you do. Your history of heart disease, diabetes, wherever it is, we can keep an eye on this. So if your grandmother had diabetes, your great-grandmother had diabetes, and your dad's side's father had diabetes, well, we should probably always check your blood glucose. Keep an eye on it. Your A1C and blood glucose, right? Just little guidance. So the role of your healthcare providers is to determine the right frequency for your blood tests. I'm going to tell you right now it's annual, for sure. Don't let them do anything less than that. They may ask for more, and if it is, listen to them because there is a reason for that. Regular follow-ups, do this. Most insurances, if you have any type of insurance, covers one annual wellness check every year, which is exactly what I talked about, the CBC, lipid panel, thyroid, sometimes vitamin D, and cholesterol, your liver panel. So that's all based in there, and it's always covered. Always there should be little to no copay with that. And that's done once a year. The rules are pretty stiff now. You got to book your next one 366 days later. That's how they know it's fully covered. If you book that another blood work before then, there could be copays or follow-up fees for that. Okay. So it's across the board. It's Medicare law. Once it's Medicare law, it's insurance law. Good. Enough about that. Actionable tips for you immediately is preparing for your blood work, knowing what is being checked. Sometimes people eat and then they go get their blood work. Are we doing blood glucose? Shouldn't do that. We want to see resting blood glucose with no food in our system, not when it spikes. Hydration, got to drink some water, make sure you're hydrated enough for that. These are things that they usually prep you for from your doctor or the lab before you go. And always ask the questions to your healthcare provider about your blood work. Keep track of all your results on your own. Nowadays, with all these new LabCorp Quest, all the places that you can go for your blood work, it's kept digital. But even on there, they'll tell you we only keep records for up to 5 years. Download a PDF copy, save it in a folder on an external drive, and that is your healthcare records for your blood work. Keep those there. That way you can always look back. The things we're running into right now is this hormone epidemic, where I call it an epidemic, but it's the doctor's fault. It's all these treatment providers' fault. Putting people on synthetic hormones. This is just one example, or, the weight loss fad that's going on right now with all these injections. I mean, we're going to cross a bridge very soon of learning the side effects and playing with everyone. Like, I feel like every guy over 40 now is taking testosterone. What is up with that? There's no way one protocol can be good for every man. Like, this is nuts. So stop and think for a second. You've got to be treating something with this. If you don't have very many symptoms, don't mess with it. I speak from personal trial right here. Somehow, with smart people, 3 providers got talked into, hey, it sounds like it's a testosterone thing. It was never a testosterone thing. And at least me, smart enough, wean off of it and get off it immediately, and hopefully never have to go back. So got to be careful with this stuff. That's my PSA. Get your blood work checked. You can do this through your primary care provider. If you don't have a primary care provider, because whatever, you just don't want to be part of the medical system, we get it. If there's anyone that gets it, we get it. Talk to a nurse practitioner, talk to your chiropractor, talk to your DO, talk to anyone else in the healthcare field, and they can gladly send you for blood work. It may just not be fully covered under your healthcare premium. However, there is a rule under the Medicare guidelines, is that any providing doctor that can send for blood work, which I just gave you examples for, will have some coverage. They have to cover some basic preventative tests all the time. So you will get a discount or an insurance fee rate for that. And typically the cash rate's super easy. $25 for a vitamin D panel, $11 for a CBC, $15 for a lipid panel. It adds up to be just under $100. For us, $140, because we usually do a little bit more. We do the thyroid. We'll do some hormones, depending for what people are looking for. We always go a little bit deeper, but that's it. So affordable. You can do this once a year, small investment into your health. And that's, so if it's been a while, you stop this podcast and you call up your provider and you book an appointment right now. Get that blood work. Make sure you're staying on top of your health. Stay well, stay healthy. Have a great week.
Thanks so much for tuning into this episode of Living a Full Life podcast. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. Thanks again for tuning in, and we'll catch you in the next episode.